Good morning. We're going to begin. We'll seat Representative Tucker for Representative Hatch. Go for a motion on the minutes.
Second.
Motion by Prentice, second by Lang. Any additions, deletions, or corrections to the minutes? Seeing none, all in favor?
Aye.
Any opposed? A motion on the consent agenda.
So moved.
Second.
And are we removing anything from the consent agenda?
No, sir.
Okay.
1 second. Yeah, we want to remove the,
Item number 3, FP 2021-1112, I'm sorry, 112. There was a request to remove that from the consent agenda.
Okay. All those in favor on the consent agenda?
aye.
Aye. Any opposed?
Mr. Chairman, who was the second on that motion?
Tucker. On the regular agenda, Department of Health and Human Services for Rule 120.
This is a conditional approval for 2021-120. It is regarding in-home supports. There has been public testimony filed, and I have reviewed the rule, the conditional approval request, the public testimony, the department's 1915C waiver in regard to in-home supports, and the department's corrective action plan. And at this time, I have no basis for JLCAR objection.
Is the department represented?
Good morning, Allison Zeno, Administrator of the Administrative Rules Unit for the Department of Health and Human Services.
Good morning, Melissa Nemeth. I am the attorney for the Bureau of Developmental Services.
Do you have anything to add on 120?
No, sir.
Motion?
Move to approve.
Second.
Motion by Lang, second by Gray. Any discussion? All those in favor?
Aye.
Any opposed? $130.
Yes, sir. This is the proposal is regarding healthcare facility discharge data, and there's only one issue to bring to the committee's attention, which is on page 7 of the linked PDF. The rule expired in 2017. However, the originating statute, RSA 126.9, has a civil penalty of $100 per day for non-compliance. So the agency can enforce compliance without the rule in place, but didn't know whether or not the committee may have any questions for the department.
Good morning. Again, for the record, Allison Zeno, Administrator of the Administrative Rules Unit for the Department of Health and Human Services.
Jiahui Chawla, Bureau Chief of Public Health Statistics Informatics in the Division of Public Health Services.
So it's my understanding that although the rules expired, pursuant to RSA 126.25 Roman 2A, does list out some requirements that the department can collect in statute. And as Attorney Reef had said, there is allowance in the statute as well to collect a civil penalty for non-compliance of that portion. And at this time, that's the only portion of data that the department is collecting.
Carolyn Virtue, is this the rule you wanted to speak?
The previous rule, Mr. Chairman.
Okay, let's finish up with 130. Questions from the committee? Motion?
Move to approve 21-130.
Second.
Motion by Lang, second by Gray. Any discussion? Seeing none, all in favor?
Aye.
And any opposed? And let's go back to 120 and hear from Carolyn Virtue.
Mr. Chairman, excuse me, would you like a motion to reconsider?
Sure.
Having voted on the prevailing side, I move we reconsider.
All in favor?
Aye.
Go ahead. Turn the microphone on.
Is the microphone on?
Yes.
I apologize. Thank you, Mr. Chairman, members of the committee. I appreciate you allowing me the opportunity to speak here today. I have submitted testimony, which I believe is included in the packet. I will not read that chapter and verse in an effort to be brief. I also have one other thing to add, which I will do at the end. The rule, as it appears before you, does not adequately provide the services provided to the recipients of the waiver. I spoke only to the service that I myself provide in a different waiver, not in this waiver, just to be clear. I do not provide services in this waiver, nor do I have any intention of ever doing so. The rule impacts the state's costs for long-term care, as well as the state's reliance on a 50% funding match. The match is jeopardized when services are not provided in accordance with federal guidance. The department testified during the course of this that the reason for not including the definitions in the rule is that they have another process going on simultaneously where they are developing a manual, and the manual will define the services. I do not think the department should be allowed to rely on an alternate process. So for example, to develop rules, because the legislative input and the consumer input is not as robust. So I've included in your packet the manual, the draft manual, I should say, draft, which has a very robust definition of service coordination that I could support. So I'd like to understand why we can't have that in rule and to have it be approved by this committee.
You brought this all up at the public hearing.
I brought this all up as chair of the Medical Care Advisory Committee. I participated in the subcommittee on this rule. These suggestions were made to the department.
Okay.
As I was working on another issue yesterday, I came across an error in the rule, and it's in 524:16. There is a sentence about whether or not remote services should be provided in hospitals, and it doesn't say cannot, it says that they can. I believe that's an error, and that would be in letter D. In regard to remote services, there are currently many, many bills pending in both bodies of the legislature in regard to telehealth. There are two bills specifically, Senate Bill 390 and Senate Bill 430, which I'm grossly paraphrasing here, set out guidance for the provision of telehealth. I think calling something remote when what it actually is telehealth is a slippery slope. It's what they're defining as acute and remote services is telehealth. It was discussed as telehealth, but the word telehealth is missing from the rule. So I am very concerned that the other work these bodies are doing on telehealth would not apply to this. The other problem with the use of the term remote services is that remote services are defined in the, and there are codes for them in the Medicaid coding manual, where telehealth is a modality for the delivery of services, and that should be a modifier to the service that we're delivering. So the language used in the acute and remote services section is hugely problematic and inconsistent with work being done by this body. And I thank you for your time. I would be happy to take any questions.
Okay, next we're going to hear from Mindy Huckins and Sarah Katrubis, who oppose the rule also.
Thank you, Mr. Chairman and members of the committee.
Good morning, members of the committee and Chairman Reagan. For the record, my name is Sarah Katrubis, and I work for Community Bridges. I represent them as an area agency that supports people with developmental disabilities here in New Hampshire.
And I am Mindy Huckins. I'm the Senior Director of Family and Participant Directed Services at Gateways Community Services, the area agency designee in the Greater Nashua area.
Do you want to start?
Sure. I'm here today to address two concerns with the 524 that is proposed today. I did provide this recommendation in writing and received receipt from Ms. Zeno on January 10th. And when the final rule that's before you today came out, we did not see changes based on those recommendations. And I'm here today to speak about two areas. The first area is 524.03, which indicates that a functional screen will be required within 3 days of eligibility to in-home supports. There are questions in the way the 524 is written about what determines the eligibility date. The response we also received from Attorney Nimeth, as well as what's written in the 524.03, indicates that it's when they became eligible for early supports and services or the developmental disability waiver. In some cases, those individuals might have became eligible 5 or 6 years ago before they asked for an in-home supports waiver service. And it says that we must also submit the 2 factors, which is a statewide assessment, meaning eligibility on that. The functional screen is required to determine level of care. In the in-home supports waiver that was approved by the Center of Medicaid and Medicare Services, it indicates the functional screen will be completed as part of the prior authorization packet, including the service agreement, the budget, and the functional screen. The functional screen, when it is submitted for the first time, must be signed off by an RN. So the concern is that we're completing a functional screen when we have not done a person-centered plan as required in the in-home supports waiver. We have not done the health risk screening tool assessment, which provides formal assessment for us to base the level of care on, in which that we're documenting the functional screen. If I give a functional screen to a nurse with no service agreement and no assessment, how is that nurse to determine and sign off that the functional screen is met? It's merely speaking with the family and checking off the boxes, and it creates a vulnerability. The recommendation provided in writing was that we continue to provide the functional screen with the service agreement and the assessed tool at time of application for the in-home supports waiver, and that was not supported or documented in the proposed rule in front of you. So,
Can I just add one thing? Just to kind of break it down even further, excuse me, what we are recommending, or what we're asking for you to recommend, is that this all be done in the way that it's done now, simply because this in-home support waiver is not offered to every child who is eligible for area agency services. These are waivered services for children. And it's important to note that there are limited slots and limited money for these services. So if we were to do this at the intake, the original intake, what our concern is that every family then now understands that they may be eligible for the in-home support waiver, and that we will have to add them then to the registry and put them on a waiting list for those services, because those slots are so limited for children. So whereas now we are getting to know families, we're starting to understand what it is that they need, and only then would we offer potentially this waiver service to them based on their needs. Instead, what we fear will happen is that every family, when hearing about the great supports offered in the in-home support waiver, they too will want them. And then all of a sudden, in a year from now, I will be sitting in front of a lot of you during the budget and saying, we need more money, we need more slots, because all of these people want this service. And so that, I just want to put that kind of bug in your ear, that this is a potential increase in cost.
And the
as well.
individuals have to have Medicaid to enter this program. When they come in through eligibility, they may not have Medicaid, and we're completing a functional screen that allows them to bill Medicaid for this waiver. And so families may also be confused that they're now eligible, but until they obtain Medicaid, they're truly not eligible. And so it should be at that juncture that we put them on the registry based on their assessment. Though families do know about this service, and it's part of our service array when they come into the area agency system. The second area that we're looking to ask for your support in today is around some language in the 524.20 around in-home support service agreements. There is a section 3 which indicates that the service coordinator shall visit the individual and contact the guardian in person or through video call at least quarterly. The in-home supports waiver that is approved by the Center for Medicaid and Medicare Services requires monthly contact, either in person or via phone contact. It does require quarterly documentation of satisfaction in a number of areas, and it does require on page 130 that the family or participant indicate how many in-person home visits they would like to select, with a minimum of 2 as the minimum standard. This ask to have us visit quarterly is not reflected in the in-home supports waiver. It does not mention the 503.110 where this is mentioned, where the rest of the waiver indicates that. The Center of Medicaid and Medicare Services is not looking for us to report on quarterly face-to-face meetings with families. They're looking for us to provide them monthly contact, quarterly documentation of satisfaction, and a minimum of 2 home visits. This would be an additional burden. We understand that at times we're asked to do more. One of the biggest complaints we're getting from families right now is that with the increased oversight from the Center of Medicaid and Medicare Services, and at times from our Bureau of Developmental Services, is that their service coordination feels more like checking boxes and less like having that expert who really knows their family and is using a person-centered approach to address issues that affect them immediately and that will change their lives, which is truly the responsibility of service coordination. When we ask for these additional things that are not required by the waiver, it takes away our ability to focus on the things the families actually are asking us to help them with. And it does not put our Medicaid match at risk, because Center of Medicaid and Medicare Services is not asking for that or looking for that, because we did not commit to that in our waiver. So we're asking this committee to keep the requirements of the 524 face-to-face to what is documented clearly in the waiver submitted.
Let's have
sorry.
a motion for an objection to the rule based on the testimony.
Senator, I just have one question. What rule are you referring to? Can you give me the citation again for that one with the quarterly visits?
Yes, it's currently in your proposed 524 under 524.20, number 3.
And if I may just add one other,
The preliminary object based on information found.
Thank you. Second.
Second.
Motion by Lang, second by Burstein. Discussion. All those in favor?
Aye.
Any opposed? The motion carries. Thank you.
Thank you. Thank you.
Senator Rager, I'm sorry, I'm not sure that the testimony given was given on the correct version. And
You can interrogate the witnesses, find out what they're.
I'm having trouble finding exactly what they're talking to. As maybe Allison can help clarify, I'm not sure.
Mr. Chair. So I did find it. I had a question, but I think I figured in a preliminary objection they could fix it. But there was, in the section they were talking about, that does talk about quarterly visits to the individual, but then it talks, the section 2 right above it talks about monthly visits. And so I'm not sure which one applied to the CMS and which one didn't. In the ones that were provided in our packet, it's on page, wait a second, in our packet.
Mr. Chairman, may I? Excuse me. The comments you're making, are they to the final proposal or to the conditional approval request? It should say in the header of the rule.
It's the final rule, the final version.
Well,
it was the
So
one
there-
provided to us by the department.
There is, if at the very top in the right-hand corner, does it say conditional approval request for 222?
I'm sorry, I did not bring it. I'm specifically quoting a response from Attorney Nimeth that was sent to us, quoting the current final rule on April 13th.
Okay, so that should be this. Okay.
I believe it to be the final. It's under, specifically under in-home support service agreement section.
All right, I found it.
Thank you.
Thank you again. Board of Occupational Therapists.
Okay, this proposal makes changes to the licensing rules for occupational therapists. The board has filed a conditional approval request, which you do have linked on your agenda. That conditional approval request pretty much resolves all of the concerns. There is one issue, and it's regarding a citation to an allied health rule regarding the licensing fee. And the comment occurs in several places. But if you look on page 2, let me go to that, you will find the first instance of the comment. And so here, what the issue is that that rule at the Allied Health Rule at 301.02 doesn't actually contain any licensing fees for occupational therapists. It's written as if it's just for licensure and certification of speech language assistance. So in conversation with Tina Kelly from OPLC, they are aware of this issue and plan to bring this forward to the Allied Health Board at their next meeting so that they can consider some rulemaking to fix that section of the rule. And Tina is here and can speak more about that issue.
Good morning. I'm Tina Kelly from the Office of Professional Licensure and Certification. I'm a program specialist. And in AHP 301.02, which addresses the fees for all of the allied health boards, the header says schedule fees for licensure and for certification of speech language assistants. It was meant to be both the licensees and the speech language assistants. So if you read it all together, it makes it sound like it's just for licensure and certification of speech language assistants, but it's meant for both. And if you look at the table of the fees, it does specifically say licensure and certification. So, but I'm going to take that back to the Board of Directors of the Allied Health Professionals. They meet on 4/28 of 2022 and rework that opening sentence and submit rules to clarify.
Okay. So they're going to run out of time? No?
Yeah, the deadline is the 29th of this month. The committee would need to ask for a waiver if you plan to postpone.
Have a motion to waive the deadline on 137.
So moved.
Motion by Lang, second by Tucker. Waiver. Any discussion? All those in favor?
Aye.
Any opposed? The Board of Pharmacy has requested a postponement, and number 104, Department of Agriculture, Markets and Food.
Okay, yes, sir. The agency has filed an amended objection response, and there are no more staff comments on that amended objection response. We didn't place this proposal onto consent in case the committee had any questions. As you may remember, the committee objected to the proposal based on staff comments, specifically to language in the rule that would allow an automatic suspension of a license without notice and opportunity for a hearing in violation of RSA 541A30 and RSA 43704. The agency first filed an objection response that deleted everything in the section, including what was currently in the rule. And you can see that in the last couple of pages of the linked PDF. In the amended objection response, it pretty much puts the rule back to where it was before rulemaking began. And the purpose of the rulemaking was to address the implementation of House Bill 250 from the last session that would prohibit the transfer of animals over, I think the number is over 49. But we had some back and forth with the agency, and this is where they landed, just to put it back to where it was. And as I said, we don't have any additional comments, but we didn't know if the committee may have any questions for the agency.
Good morning, Senator. Good morning, committee. Steve Crawford, State Veterinarian, New Hampshire Department of Agriculture.
Questions from the committee? Representative McGuire.
Yes, thank you, Mr. Chair. Just curious when you are going to implement that law.
We already have. We're not sure. The law didn't require rulemaking to implement. It created, if you, and I brought it here just so I could read the language. So the legislature changed the definition of pet vendor to mean any entity that transfers 30 or more dogs, cats, ferrets, etc. All license, and then in 437.3, no pet vendor shall transfer animals without a license. That's always been the standard. The addition here was that, and it's always been a requirement to have proof of zoning before we issue a license. the legislature in August of last year created a standard that no zoning approof is required until someone reaches 50 animals. So we can still issue the license, and we have without zoning approval. I think there are 3 entities thus far that have been licensed without zoning approval. No one's reached the 50 yet. So we've begun to do that. We just haven't gotten to the, and I think from our discussion with Jelco attorneys, the process for someone who reaches 50 animals without providing proof of zoning is already in statute in 541 and in our AGR 200 rules in terms of how we handle notifications and hearings and administrative process.
Do I understand you correctly that if someone has a business and they only sell 29 animals during a year, they don't need to be licensed, so they don't need zoning approval?
Yeah, so there are essentially three levels. So 29 animals or less in a year, you don't need to be licensed with us, regulated by us.
Just sell your
30,
your kittens
30 to
or
49 requires a license without zoning approval. 50 and up requires a license with zoning approval.
I sure hope everybody understands that. But
We're,
thank you
we're,
for the
we're trying to
information.
come to grips with it too, but thank you.
You're done.
Move to approve.
Second.
Motion by Lang, second by McGuire. Discussion. All those in favor? Any opposed? The rules approved.
Mr. Chairman,
Yes.
on the previous item, in order to postpone that is going to require a waiver of the committee's deadline. So if you wished a member to make a motion to postpone and seek a waiver.
So move.
Motion by McGuire, second by
Second.
Lang.
Third.
Any discussion on the motion? All those in favor?
Aye.
Any opposed? Waiver's okay. You have any other business?
One item, just want to make the committee aware that starting on May 6th, we are going to have another attorney working for us. Her name is Rebecca Ricard. She currently works at DCYF. We have, since sending out the letter notifying agencies of expiring rules, we are having an uptick in the rulemaking, and it looks like at the current rate, we'll have at least 200 proposals this year.
Thank
And
you.
Senator, I think we still have item 2021-112.
The one-off consent. Okay. Child care program licensing rules.
So as this was on consent, the committee staff have no comments, but I believe there are people here to testify.
Just come on up if you filled out the card.
I also think it's important that I point out that one of the people testifying is actually the owner of the daycare that my child goes to. So just to put that out there, I don't think that there is any conflict, but if we decide otherwise, one of the other attorneys can take this.
Okay. Do you wish to testify? Come on.
New with this, sorry. Hi, my name is Kristen Byron, owner and director of a child care center, 2 of them in Manchester. Thank you. I'm fairly new at doing this. I was hoping to hear the state speak first in regards to some of these rules. For many years, I've run a child care center, and I've come across different ways of doing things and try to be objective looking at things. But in these particular rules, and I was just told that it didn't really matter, but a lot of childcare centers are at work right now. And it's very hard for us to even get out to be able to come up here and do this. So I've been trying to listen to a whole lot of other people and what they're saying too, so bear with me. But a big problem that we're having is this whole fingerprinting issue. we're all for wanting safe people to be working with children. And we know that they should be fingerprinted and background checked, et cetera. I don't know where exactly in the rule, and hopefully Melissa can help us out. She said it's a different issue, but I do need to bring it up because before a person can be working for you, they need to be fingerprinted. But the wait time is so ridiculous that you end up losing great staff members. There's got to be a way to fix this. I don't know if anybody has any great ideas, but we're open to that. And maybe like if you can be fingerprinted in DOE, you maybe could be also okay for DHHS. And I don't know how to fix that, but that's a huge problem that one day when I have more time, we will look at. Specific rules that I'd like to look at today is on page 11. And that is basically what gets posted on the internet, and who and how it gets determined. That was huge. So if we could look at that a little bit closer. Page 26, there's an evacuation plan. I personally was on the phone with my insurance company for roughly about an hour because my program specifically does not insure children going off premises. And under this specific rule, we have to practice an evacuation offsite bomb threats once per year. I understand why they might want that, but how do you do that when you're the owner and I can't bring the children off premises? So I feel as though that rule needs to be looked at on page 26. Also on page 13. Again, I'm sorry, these rules are different than the rule book that we're using now, so I'm going back and forth. The informal dispute resolution. We've talked about this lots and lots of times, and I don't see anything getting changed there. It's basically their word against our word until that's how it goes. And I just don't like things personally put on an internet that may or may not be true on a state website. So the informal dispute resolution really needs to be looked at further. And also on page 61, I'd like to see something added under professional developments. I've read a lot of citations that have been on the state website and all, and I feel as though maybe some people need to learn a little bit more what a corrective discipline approach would be for children of different ages. You know, and what you could do with them. So maybe add to our pro-solution classes as we have medication and transportation and things like that. Maybe something about appropriate discipline for young children and make that a mandatory class.
Did you receive notice of the public hearing for these rules?
I did, and unfortunately, I'm working about 24/7, as I'm sure other people are too, and I was unable to make it. So again, these are things that were brought up there, but now here they are, and I can't just say, here, let's pass them, because I'm on the other end, but I try to look at things on both sides. So thank you for listening. I appreciate your help.
Sally Wallen-Weber.
Good morning, members of the committee, and I am the owner of the Tot Spot, and I do have your child at our program, and he's very lovely, so thank you. I'd first like to thank also Child Care Licensing for the work that they have done to improve these licensing rules. We've seen a lot of improvements, and they have really heard some of our feedback, but not all of it. The licensing unit had an audit by the legislative committee. You may be aware of that. And in that, they found that there was over 1,000, approximately 1,000 licensing rules. And for any program on any given day to know, manage, and be in compliance with 1,000 licensing rules is nearly impossible. It sets programs up for failure. And worse than that, it sets us up for violations and infractions, which could lead to fines and potentially program closures. So I'd like to just kind of set that as the tone. A lot of times we hear programs talk about overregulation and certainly rules that may overstep the discretion of the program or the business. And so a few of those I wanted to talk about is HEC 4002.11. There is a rule about children who are ill and sick exclusion from programs. That's on page 17. And essentially what it indicates is that children shall not be excluded from childcare if they do not meet one of the following requirements, and they list them out. I think for programs it's really challenging. We're still in a pandemic, and programs are with most of these children anywhere from 20 to 50 hours a week. Their teachers know them intimately in terms of the daily interactions, and we need to have the right as programs and as private businesses to decide if a child is not well enough to be in our program and send them home. So my issue is with the word shall. Shall means must, and you'll hear me say that a few times during my testimony today. So I just think it's too restrictive and it removes the discretion of the program. And I think that's, I think that's an overstep by the department. So I would request that that language is specifically amended to remove shall. In addition to that, on 4002.19G, also tying in with that on page 29 is about sick children going outside. And it's a mandate that if a child is ill or not feeling well or perhaps has an allergy, that the program shall not make them go outside. Now, our teachers must be in ratio. So for example, with toddlers, it might be a 1:5 or 1:6 ratio. Well, if you have one child whose parent says they do not want them to go outside, it means that the other 5 children cannot be out, or that child needs to be moved to a classroom where perhaps they're inside at that time period, but then that might put the program over ratio. So again, I feel like programs really need the ability to have the discretion to say to the parent, if your child is not well enough, then perhaps they either need to stay home or you need to find a program that is a better fit for your child's needs and your family, because it just really compromises our ability to care for the entire group rather than looking at the individuality of just one specific child. So again, I think that's just an over-regulation of our programs. Throughout the rules, the manual, the rules manual for programs to follow, it is scattered. It needs to be simplified. I know that licensing, the staff have talked about, they have certain administrative rules that they have to follow and how they format their rules, but it's not user-friendly. And so you might be going from, that you have to have documentation of immunizations on file, and then you skip to something that's completely different. And so it's really difficult for programs to stay in compliance with over 1,000 rules when they're not neatly grouped together. And again, I think it creates a lot of incidents where things can easily get missed. As legislators, none of you probably would be able to remember 1,000 laws on every given day and be able to implement those and speak to them and ensure that your staff know every single one of those rules as well. So I think it's an unrealistic expectation. And there are a lot of items that I think could be put into best practice as like an appendix or another way to handle some of these pieces. A big issue that I also have is 4002.03, and that's timeframes for departmental response. And essentially, childcare licensing, I believe, they need to be held to similar standards that they subject their licensees to. The timeframes and the discrepancies between the amount of time that they get to respond and submit things back to programs is inequitable and unreasonable compared to the many, many incidences of timeframes in which license programs are subject to. One in particular is providing licensed programs and licensees their corrective action plan from the department within 21 days. I would make that recommendation. There is nowhere that I saw in the licensing rules that they have a set time frame. So initially we have our monitoring visit, and then within 21 days, the licensor is required to send us our statement of findings. In my case, in 2021, the licensor came in July, at the end of July, and I didn't get my statement of findings until the end of September. That far exceeds the 21 days. We need some measure of accountability for the department when they don't meet their own timeframes. In addition to that, my particular statement of findings was incorrect. The wrong rules were cited. I requested that they reissue me a correct statement of findings, and that did not happen until mid-November. I responded with my corrective action plan, which, mind you, my licensing visit was July 28th. I resolved the issue the 27th. I resolved the issue the 28th. I sent them a letter. I sent them the proof and said, this is proof of my corrective action. So I did it the very next day. And it was relative to fingerprinting. My employee could not get fingerprinted because everyone was shut down. So long made short, I submitted my corrective action plan once the statement of findings was corrected. I still have not received an official response back from the department. And this morning, to my shock, I went on just to double check, and I found that my corrective action plan was posted to the internet without my knowledge. And that was done on December 1st. The law states in 170E that they're supposed to notify us 6 days in advance. I wasn't notified. I still don't have an official copy. And this is required to be posted at my center for parents to review and for when the licensor comes. I'm not able to be in compliance because the department has not done their job. This is not an anomaly. I'm not the only program this happens to. Anecdotally, I hear from programs over and over again that the timeframes in which the department responds is inadequate. Sometimes it's taking months and months, and sometimes almost up to a year for us to get necessary paperwork back for us to be in compliance. So I would ask respectfully that the committee hold licensing accountable and require that they have a 21-day, because that's pretty consistent with 4002.6D and with G. 21 days is, we have 21 days to get our plan in, they have 21 days. I would ask that they have to have 21 days to get our corrective action plan back. Because it's not reasonable that we're hanging out to dry and waiting and waiting and waiting. And I don't believe that it should be the sole onus of the program to repeatedly follow up with and notify CCLU that we have not received our paperwork back. So I think that's really important. And I think that ties in with what Kristen Byron talked about, having things posted to the internet. Now, granted, my corrective action plan was fine and they approved it, but they should have notified me. I shouldn't have gone on and been surprised to find that on December 1st, that they had posted it 3 days within receiving it from their office, both electronically and through certified mail. So I just, I think we need to have fairness and equity amongst timeframes and responses. And then the other thing I wanted to talk about, I know there's a lot of discussion about fingerprinting is set by the Child Development Block Grant from the federal government. However, in our state statute, 170E7, 4A, and 4D, we are required to have eligibility cards. Eligibility card is simply proof that your staff has been fingerprinted and they've cleared their background checks. Now, while the fee is set in stone in 170E for $50, the language says that the department may issue an eligibility card. May is not shall, it is not must. It creates a tremendous burden on the individual worker who may make anywhere from $12 an hour on average. And I also think it creates an increased burden on programs. I've probably spent close to $700 to $1,000 in the past year or so trying to onboard staff who may not even show up to their job, but we've already submitted the paperwork and the department has cashed our check. Or what happens is I probably have 3 to 5 employees that were fingerprinted in 2021 between probably July and September, and none of those individuals have received their eligibility card from the department. So I have paid the $50 a piece for them. The department has cashed my check, and they have not sent an eligibility card for them.
So my question for you is, how long have you been in business?
I've been in business for 10 years.
For 10 years, and how many people have failed their background checks?
And that I've hired,
Yes.
none. We had one individual who's,
Kristen, have you had any? No?
yeah.
Right.
Yep. And so for the eligibility cards, the state is taking our money, but they're not providing us with the service or the card. And we, again, according to licensing rules, we're required to have a copy of that eligibility card
Okay.
on file. So I would actually ask that the committee make the decision to override DHHS and not require the eligibility card at this time. The statute says may. It does not require it. It just requires the fee. And then just to lastly wrap up, and I thank you for your time. I'm sure many of you have seen this in the news. I know many of you sit on other committees. We are in a dire workforce crisis. The fissures and cracks have become canyons in terms of our ability to find staff, let alone qualified staff according to licensing standards. Graciously, intelligently, the legislature gave us a huge win with modifying and putting into statute the requirements of an associate level teacher. However, it still does not go far enough. Programs like mine are suffering. We are on the brink of closing because we do not have staff. It is the worst I have seen in 10 years, and I'm sure Kristen, who has been in business way longer than me, can tell you, programs like ours never went understaffed. We did not have problem finding employees, and we do now. I've had positions, and I know colleagues that have had positions open for well over a year. And even when we are offering middle to high wages, 5 weeks paid off vacation, $500 sign-on bonuses, we are not getting applicants. So I would ask, and we have approached licensing repeatedly to say, give us some leeway on the assistance. They are not allowed to be left alone with children unless it's, say, walking a child to the bathroom, transferring them between classrooms, sitting with them when they're waiting for a parent when they're sick. I'm not suggesting that someone who has no education or experience should be solely left alone with children. However, we need people to fill these spots. And we have loving, caring parents who have life experience, but they don't have college, they may not have the college credits, or they may not have been in a certain position that rises to the level that they could be associate qualified per the definition of the legislation's definition of associate teacher. Allowing us to have a little bit more broad leeway with assistance in a classroom, say, being able to sit alone with a child or a class during nap time, providing that there's other qualified individuals or staff in the building, would go a long way. We need something more to fill and to create a stopgap for the crisis that we're experiencing. And it's insurmountable. The stress that it creates for business owners, the burnout that it's creating amongst their colleagues. We're losing people right and left. They can go to Target and work for $20 an hour, or McDonald's for $17. So the field is not appealing right now, and we are doing everything we can. And for programs that have tuition as their sole source of income, they cannot afford to pay high wages. We can't find substitutes even to cover when people are out sick. So I really would encourage the committee to press and impress upon licensing that they need to do more. And it's not so much about, we want quality applicants. Absolutely we do. We want educated applicants. But if we do not have workers in our childcare's programs, parents are not going to have childcare because they will continue to close. And we have seen the numbers go down drastically from how many licensed programs there were even 4 or 5 years ago. And at one point we were closer to 1,000, and I think now we might be under 700. And licensing will tell you that some of those switched hands and some of them consolidated, but a lot of it is that people are tired of the overregulation, the overreach of licensing rules, and they can't make ends meet with the restrictions that are upon them. And times have changed, and they were changing before COVID. So this is not a COVID issue. So I'm sorry for taking so long. I have testified at public hearings. I have given my input to licensing, and I feel like this is kind of the last measure, because although licensing, I'm hoping that they are looking forward and will be willing to work more continue to be more collaborative with programs. But our history shows us that we have made the battle cries and they have not responded.
Representative McGuire.
So.
Yes, thank you. I'd like to comment that the requirements for lowest level of staff is a policy fight that's been going on between people that want to have more individuals involved in child care, like you say, the parents with life experience, and those who think it should be a profession that requires significant academic background. And we've tried, there have been various occasions over the last few years to expand the scope of life experience, but it's never quite enough, I'm afraid. And it is a problem that we keep seeing, that you're running into a difference of what quality is, and of course the trade-off between quality and quantity. I'm sorry that you're stuck in a bind, but you are not alone.
I know, and I can tell you from the 10 years that I have been in this field, I have had staff with master's degrees, and after hiring them, I am shocked at their inability to connect with children, their lack of common sense. And I have had substitutes and assistants and young ladies who have worked with me that are loving, caring, compassionate, and they do really, really well with children. And I would pick them any day over the week than someone sometimes with a lot of experience, because they don't always know how to put that into practice.
Okay, is there anyone here from licensing?
Are you through with me?
Yes, thank you.
Thank you so much, committee.
Just for the record, Allison Zinno, Administrator of the Administrative Rules Unit for the Health and Human Services.
Good morning, Mr. Chair, members of the committee. I'm Melissa Clement, and I'm the Chief of the Child Care Licensing Unit. Is there any particular place you want me to start, or should I just want me to address what we've heard so far?
Well, just respond to what.
Sure. So to respond to Kristen Byron, who spoke first regarding the fingerprinting and the concerns there. The fingerprinting is a federal requirement. The appointments come through the Division of State Police, so we don't have control over when those appointments are available, how often they are.
So what's their
available.
response to you when you say that these people can't operate their businesses because they can't get fingerprinted?
We've been working with state police in order to try to speed up their ability to have appointments. I know the state police have received money in order to obtain 11 more of the fingerprinting machines so they can be placed around the state, and they're working on implementing that. My understanding is that there's always an appointment pretty much within a week of when someone goes to make an appointment through the state police, and there's state police appointments. There's also appointments available at local police departments depending on the community you're in. So programs usually can get an appointment within a week. They may have to travel for that because they're scattered around the state, but they are available. It's not soon enough. I understand the pain that the childcare programs are going through. I'm hopeful that these additional machines, when they come on board, will help increase the availability of appointments. But my understanding is there is usually within a week, depending on where you are in the state, you can get those appointments. It's a requirement for the federal government that everyone have those background record checks. Kristen also spoke to an ability to use the Department of Education. We're not able to do that because the results of those background record checks have to come to the Department of Health and Human Services, and the FBI requirements do not allow the sharing of fingerprint results. So if a fingerprint result was taken for a school SAU, if they were done at that level, they can't then share those results with us. We're required to receive the results. So it's a federal requirement that we're not able to change. And I know the childcare providers are working with our representatives at the federal level to try to make some adjustments, but that's the federal rule at this time.
There's also we're creating a study committee to look at the prospect of centralizing such records checks in education, because it is absolutely insane that that somebody that happens to work in more than one position that requires a background check should have to get a separate background check for every single position, because the Department of Education can't tell the Department of Health and Human Services, yes, this person is clear. And it may be a federal requirement, but it's an incredibly silly and it's a ridiculous requirement. And so I know we're looking into it because that's a concern for a lot of people.
I am very happy to help with any study committee that you have on this. There's an additional wrinkle with our requirements through the Office of Child Care, because we're required to do what's called a National Crime Information Center check of the sex offender file that rests with the FBI. And that our federal requirement, that is the only way you can get that is through a state police or a government agency. It's a law agency. So Department of Ed doesn't have access to check that one file that we are required to check. So I am all for trying to increase the ability for us to share results, but that is an additional wrinkle that we have as the Department of Health and Human Services. And I'm happy to help.
Do your, excuse me, Mr. Chair? Do those access cards you give out after someone is fingerprinted include the result of this background check?
What it says is that you're eligible to work in childcare. So the card itself shows that we have done our FBI checks, and the NCI check, our abuse and neglect checks, all of those checks.
And a person can use that for multiple employers?
Yes. Multiple employers for licensed childcare, absolutely. That's the purpose of it, so that employees will have that when they go for a job interview to say, you can see that I'm current.
And to follow up, is that why are there cases where you haven't sent those out?
We're working through our backlog. We had system changes last summer with our new system, and some of it has to, it's a multi-prong issue. Some of it has to do with the state police and us getting results from them, because they shifted to their online portal for their results last year. We are working with state police. We have a spreadsheet on people that we are working on getting those results and making sure that we can issue the cards. And one thing I want to impress is that I am first hearing today from Mrs. Wollenweber that she hasn't received the cards. I haven't heard that. I'm sure she has communicated in people in my department, and I will definitely go back and check in with them on that issue, but if she had reached out to me directly, which I have told providers many times, we are working through these issues, and I will be on that as soon as I get back to the office so I can provide her with an answer. The fees for the background record checks that are currently in statute are actually in Senate Bill 430 right now, to be reduced from $50 to $25. So I just wanted to bring that up as well. We are working for that relief. The reason in statute why we have may instead of shall is we did not want to require everybody who works for a childcare program to have one of those cards. We were looking at it more for the teachers and the workforce. A lot of programs hire janitorial staff, so they're not going to be hopping from childcare program to work. They're working for that one program. There's no need for them to have one of those cards. So that's why in statute it is may instead of shall. We wanted to have flexibility as to who, and that is stated in rule as to who is required to obtain a card and who is not.
Mike?
Mr. Chairman, the public testimony you heard was compelling and discussed some important issues, but I think it addressed policy issues, not bases for objection. And I think many of those issues may require statutory changes.
Yes. Yes. So do you folks understand that things that you think we can do, we can't do, and that there has to be changes in statute? Mhm. Yeah. Don't leave till I speak to you. So we understand the distress you're in, and these are things that require statutory changes in order to force the agencies to do things faster, better. So,
Can I speak to something? And when you're talking about the stress, like Representative McGuire stated, we had changed the associate teacher. That is now what's involved in this rule. That statutory change has been adopted in rule. We sent out guidance last October when it was effective for programs to start using that. Although I do completely understand the stress programs are under, I don't think the qualifications is where the stress lies. There are workforce shortages across the state in many industries. I don't think lowering the standards of our qualified staff is going to change what the amount of applicants that they receive. In addition to that, we have a waiver process. I review and approve waivers daily about they found someone that they really liked and they want to be able to hire them and have them work in the position that they're hiring for. And we give them time to come into compliance. Like, we'll give them a year to take the courses they need to take or the training they need to have. That is something that we do regularly all the time. And I am happy to entertain any waiver that a program brings to me when they feel they have found the right candidate.
what are our options?
The committee can approve the rule. If you feel there's a basis for objection, you may object.
Of all the things I've heard today, I think the most concerning is the statements by the people who run the daycare centers that they're not hearing with the 21 days. In other words, it's not an equal accountability on response time. And I wondered if we wouldn't want to give the agency a chance to respond to that.
So that 21-day response time is now in the rule. So that was a new statutory change and something that we are implementing with this rule.
So are you finding that you're able, could I do a follow-up? Are you able to respond within 21 days to the centers?
we are certainly gearing up for that, and once the rule is passed, that will absolutely be what we are doing. We have definitely speeded up our response time. We are implementing a new system which will be live in several months, which will allow us to have that response times be much quicker. But until then, we have other processes in place so that we are ensuring that we are getting those visits out.
I
those
can see that
reports out.
that would be particularly irritating.
Yes.
Thank you.
Just for information, House Bill 1507, which requires investigatory program findings to be timely published, has passed the House and is on the consent calendar in the Senate. So that should set the timelines more equitably, I hope.
If I may, my name is Doreen Shockley. I am the manager of the Bureau of Licensing and Certification at the Department of Health and Human Services, overseeing all licensed facilities from birth to end of life. And to the question regarding timeliness, it is something that has come up numerous times over the course of the last 2 to 3 years. We have worked very diligently to improve our own response time. We agree with the community that we need to be held accountable. We've talked numerous times about workforce. We also struggle with workforce. Our support team usually is 5 people. It currently is 2. And as the manager, I've stepped in as well. And I can tell you with personal experience, since December, our response time has been within 14 to 21 days. So we have, in fact, improved that. So I wanted to be very clear. Melissa, as she's been involved in other things, hasn't been as involved in the support and the response time, but I have been based on the comments from the community. So I just wanted to make that perfectly clear that we are
Thank you.
committed to that. Thank you.
I also would like to add the response time in the rule 402.03 of 60 days is actually a 541A requirement, and it's that the department must respond no later than 60 days. If the committee wants that to be changed, they would need to do that in the rule, but it's not a minimum requirement, it's a maximum requirement.
Good morning, members of the committee. If I may, I am Deborah Nelson. I am the Bureau Chief for Child Development and Head Start Collaboration, and we administer the Child Care and Development Block Grant funds, as well as the Head Start Collaboration Office. And we are very invested in supporting the passage of this rule, because if not, we face potential very stiff financial penalties, because much of the federal requirements that are in federal law for the Child Care and Development Block Grant are going to be addressed in this rule. We had our first ever on-site monitoring visit last April, because the Office of Child Care never did state on-site visits before, and they decided to start. So New Hampshire had ours last April, and they uncovered a number of issues of noncompliance that we really didn't know we were not in compliance. It was our interpretation of what the rule said and what we, versus what the federal administrator said. So we have been, states have been given technically by September 30, 2021, all states were supposed to be in complete compliance with the 2014 reauthorization from the CCDF block grant. Of course, with especially background checks, few states are, but we've got some minor issues, but a few more significant issues, especially the background check, which is going to be covered and put us in compliance when this rule passes. If it doesn't pass, and we expect to get our letter probably in the next month or so from the Federal Office of Child Care, telling us what they're going to do to New Hampshire if we're not in compliance, and we stand to lose at least $1 million or more. So very concerned that, we do whatever we can. I mean, I absolutely, my heart and, empathy is with providers. Over the last year, we've worked closely with licensing and other professionals in our Division of Economic and Housing Stability to bend over backwards to do whatever we could to put in emergency policies to share up and keep the doors open in childcare. We got $143 million of COVID relief funds. In my little bureau at one point, there were 5 of us, because half were out, with the COVID themselves, trying to deal with, all of those funds, getting money out to providers, changing policy to scale back the rules so that they could just, get people in the door. But now we're in the position of moving forward in what the federal government calls the Build Back Even Better phase of the pandemic, just trying to, shore up for long-term sustainability of programs. But at the same time, we want to make sure that people can keep their doors open. We want to make sure that our children and families are getting high-quality supports and services that are healthy, safe, and support their development to prepare them for the best success in school. So these rules reflect not just one, but 4 different aspects of non-compliances that directly impact us, which then it will impact if we get federal penalties. I don't have as much money to put towards child care scholarship fund for children, or as much money to support programs to get their quality even higher, and support professionals to gain skills that help them be more satisfied in their positions because they feel comfortable in their positions and have the skills to work with children. We heard about the challenging behaviors and that whole issue in the request to require certain training around, positive behavioral supports. We have a lot of initiatives going on right now where folks can get free coaching. They can take free online courses around.
But they can't do their own fingerprinting.
I wish
They
we
can't
could.
get people, they have people that want jobs and they can't put them to work so that the parents can go to work of the children that they take care of. So let's
Understood.
not confuse it with all the other 998 regulations.
No, I understand that, Senator. I absolutely do. And I think, as Melissa was saying, we've been working, all of us, with the Department of Safety. We've been working with the federal government. We've been working with the FBI. What can we do to address that problem? And with the Department of Ed, we actually had a joint committee looking at, can we share, what can we do to make this easier for programs? So some of it's, above our pay grade and over our heads and not in our peer review, but we're certainly working to resolve it.
So apparently, if we don't pass the rule, we make things worse. So what's the pleasure of the committee?
Move to approve.
Lang moves and Tucker seconds to approve the rule. And we'll lean on safety for what good that might do.
We even offered them some money if they needed more staffing to help move things along. So, whatever we can do to collaborate, we're happy to do so.
And they indicated they're having problems with staffing.
Yeah.
Yes.
That's
Yeah.
Right.
I mean,
They
this-
have to get their background checks through first.
So the state is down about 20% of its total workforce. So it's everybody's in the same situation that the operators are. So any discussion on the motion?
I'd like to thank all the people who came in to speak from the provider's point of view. We know vaguely as individuals about these problems, but clearly work went into their presentations and I have a better grasp of the problems. Thank you very much.
So you've heard the motion. All those in favor?
Aye.
Any opposed? So the rule's approved, but we're all alerted to what the distress is. So,
And I trust the department will consider making some of the minor corrections that the operators have suggested. And we can't help with the fingerprints, but the other details,
right.
they should be agreeable.
Thank you.
Okay, thank you, ladies.
Mr. Chairman, would the committee like to cancel its continued meeting on May 6th?
Yes, we'll cancel the continued meeting. Do we have any other business? Meeting is adjourned.
Thank you.